Hello nursing geeks, it's Jay, and today I'm going to be going over nursing process, the most fundamental thing in nursing school. Now, this is the one thing that you cannot take for granted. This is very important, and it's going to be used all throughout your nursing career, and especially during NCLEX and all your exams in person. So, let's get into it. So, ADPIE, ADPIE, what does that stand for? Well, it's not sure anything, but assessment, diagnosis, planning, interventions, and evaluation. So, what does that mean? Assessment. I'm going to assess my patient. I need to know something about my patient. What's my patient's status? Like, are they critical? Or are they good? Like, what are they in here for? I need to know something about them if I'm going to be their nurse and take care of them. So think about, you're going into your first clinical. I'm going to my patient's room, and I'm like, hey, my name is Jay. I'm a nursing student at Mercy College of Ohio. Can you tell me your name and date of birth? Right off the bat, I'm assessing. Can they tell me their name and date of birth? Do they know who they are? Like, are they A&O times 3, or times 4, or times 1, or not at all? Next, diagnosis. If I find an abnormal, if they can't tell me what their name is, that's an abnormal assessment finding. So I'm going to diagnose it. I'm going to put a name to it. So they can't tell me their name and date of birth. They're not A&O times, they're A&O times 0. So obviously I have impaired mental status. So that's my diagnosis. I'm putting a name to that. This is what this is. This is what this assessment is telling me. So I know what this is. Now planning. So what am I going to do to kind of resolve their altered mental status? So I'm going to, maybe they just woke up in the hospital and they don't know anything. So I'm going to reorient them, maybe get psychology involved if it's not improving, or psychiatry, I'm sorry. And then interventions. So I'm going to I planned that I'm going to reorient them, and now I'm going to actually reorient them. I'm going to put my thing into play, tell them where they are, that, hello, you're at St. Vincent, your name is this, Mr. Smith, and your birthday is 10/15/1979. Simple. And evaluation, which is my favorite part of the nursing process, because it's also called reassessment. You're reassessing your patient. So, can they tell that back to me? Can they retain information? Did my interventions work? If not, let's go through ADPIE again. And even if yes, it did work, let's go through ADPIE again. What else? There has to be something else that's wrong with my patient, otherwise they wouldn't be in the hospital. So let's put this into a real life example that I've had. So once I walked into one of my patient's room, and right off the bat, I saw their oxygen saturation was 83. So there I was just like, okay, ABCs, airway, breathing, circulation. The order of Maslow's order of what's most important for my patient to survive right now. So airway is number 1, and I can see that they have a perfectly fine airway, but their SpO2 stat is in the 80s. That's not good. So right off the bat, I'm saying they have something wrong with their breathing. So diagnosis, I'm going to put a name to their decreased oxygenation. So I know they have a problem with oxygenation, impaired gas exchange, or maybe impaired circulation. I'm not sure which one, but I need to find which one. So I see they have good cap refill, but their hands are cold and they're pale. So I know I might have decreased perfusion. Something might be their lungs aren't perfusing and their blood's not getting oxygen. So that's my diagnosis, impaired gas exchange. Planning. What am I going to do? Well, if they're not on oxygen, I'm going to put them on oxygen. If they're already on oxygen, maybe I need to turn up the oxygen. Maybe I need to titrate it up. So that's what I'm going to do. I'm going to titrate the oxygen up. I'm going to put them on nasal cannula. Start at about 2.5 liters. Make sure you don't hyperoxygenate them, because you can't over-oxygenate your patients. You don't want to do that, but that's later. So that's what I'm planning. So I'm thinking, okay, I need to get my nasal cannula. I need to raise the head of the bed, make sure they're up so they can breathe easier. Make sure their airway is completely clear. Now intervention. So intervention or intervene. You're doing that. So you're putting in your plan. I'm putting my patient on oxygen, and I'm going to continue to monitor my patient. Evaluation. All right, I raised the head of the bed, put them on oxygen. Did that work? What's their SpO2? Did it come back up? All right, it's at 97. Okay, that's good. So I know my interventions worked. So now I'm going to continually assess my patient and make sure that it stays that way. And so I know that their oxygen stat is good, but I'm taking their history into consideration that they still had this oxygen issue. So my diagnosis is going to be risk for impaired gas exchange, because maybe this oxygen is working now, but maybe in the future it can go back down. So what am I going to plan? I'm going to plan getting the pulmonologist involved, maybe getting hematology involved if they have some sort of red blood cell disease. Intervention, I'm going to get them involved. I'm going to actually contact them, evaluation. What did they do? Did they respond, or are they getting involved in the case, or do they really don't think it's necessary to get involved at this moment? So that's kind of the nursing process, so I hope that kind of helps you see what's going on. So now let's try some case studies. Mr. Smith is a 72-year-old who was admitted to the hospital for changes in behavior, dysuria, and a fever of 103 degrees Fahrenheit. He was diagnosed with the UTI and was put on a broad-spectrum antibiotic. So, what does this case study tell me? So this tells me that Mr. Smith is 72. He's a little bit older, so his body's not going to be adapting to changes as much. And he has a UTI. So I know a change in behavior is expected of the UTI, a fever is expected of the UTI, and dysuria, painful, maybe difficulty urinating, that's expected of a urinary tract infection. So all those symptoms are pointing towards the urinary tract infection. So assessment, that's he's febrile, he has alters in mental status, and he has difficulty using the restroom. So that's kind of what I can gather what's kind of wrong. So diagnosis, so I'm going to diagnose, one of my nursing diagnoses is we're not going to medically diagnose, remember that's not in our scope of practice, but nursing. What are these symptoms telling me? That's what nursing diagnosis is. So we're putting a name to the symptoms. So altered mental status, dysuria, so he has impaired urinary elimination, and fever, so maybe he's impaired comfort. So now I'm going to rank according to Maslow's Orm's theory, and dysuria is probably going to be my number one risk, or what I want to fix first. So assessment, dysuria, diagnosis, impaired urinary elimination, planning. So now what am I going to do to kind of fix this? So maybe I need to bladder train him. Maybe I want to use the least invasive method first. So I'm going to maybe press on his bladder. Hopefully pressing on that will kind of stimulate him to think, oh, I need to pee now. Especially if he's mentally impaired, we might need to kind of physically stimulate things that we would normally regulate ourselves. So now I'm going to actually do that. I'm going to try to bladder train him. I'm going to push on that bladder, maybe run some water in the background to make him think, oh, that's right, that water, I need to pee. Evaluate, did that work? Let's say, no, it didn't work. Okay, so what am I going to do? I'm going to assess. So that didn't work. So I'm going to bladder scan. Does he need to be straight capped? If it's over about 350, we would normally straight cap our patients. So get a medical order and see what the doctor thinks. And then continue down the process again. So now let's go into a little more severe or critical case study. Sarah, a 16-year-old, was admitted to the ER post-car versus train NVA. Now, an NVA stands for motor vehicle accident. So she was in a car crash. Medics report that she lost consciousness and was alert and oriented ×2 to person and time. Medics state that they administered vasopressin 30 milliliters an hour to control her BP of 65/24. Now, right off the bat, blood pressure of 65/24 is not good. The problem doesn't say anything about her airway, her breathing, so we're just going to assume it's fine. NCLEX, if it doesn't say it, if it does, I tend to overthink those questions, so that's where I struggle. I'm just well, what if they're airway? What if they're not breathing right? But the question, NCLEX is a perfect world, so just assume their airway and their breathing's perfectly fine. Their blood pressure of 65/24, that's not good. That's what I want to focus on. So everything else, ANO ×2, that's not the best, but we don't need to fix that right here, right now. So BP of 65/24, assessment. That's impaired circulation. So I'm going to diagnose that impaired circulation. We need to fix that. Planning, what am I going to do? I'm going to continue giving vasopressin. I'm going to reassess her blood pressure. That's going to need to be a part of the plan to constantly reassess her blood pressure. So I'm going to monitor her blood pressure every 5 minutes. I'm going to maybe titrate that vasopressin up if I have the doctor's order for that. Maybe try epinephrine, try more pressors. Do we need to get, we definitely need a medical doctor for this situation, so we need to implement, do we need to Trendelenburg, reverse Trendelenburg, get their vital organs oxygen and nutrients, get that circulation. So now, interventions. I'm going to do all of that. Evaluation, reassess. What's her blood pressure at now? How's her peripheral vascular system? Does she have a pulse in her arms now? Is she cyanotic? Can she talk? Is she more alert and oriented now? Things like that. So hopefully that makes sense. So that's the nursing process. It's just constant. It's a constant cycle. I can't stress that enough. Just because you're on evaluation doesn't mean you're done. You have to reassess your patient. Go all the way back up to the top. So if you have any questions, please let me know, and have a good day.